All right, we are live. Welcome to Koviki Talk. Koviki Talk is a multi-episode series where we talk about all things COVID-19, but we do it from the PI perspective. So we have Pacific Islanders on talking. It's important to have people that look like us and talk like us and get information from other Pacific Islanders. So that's really what COVID-19, Koviki Talk is all about. If you didn't know, now you know. Koviki is the Pacifica word for COVID-19. So we've been making our way around the country, spending time with different regional teams. We had San Diego, Southern California, Northern California. I think we were in Utah last time. Today we have three beautiful island ladies that we are blessed to share space with. It is Arkansas, Melisa Laelan, Jenitha Henson-Debrum, and Michelle Pedro, right now on Koviki Talk episode 13. So I'm going to ask Jenitha to introduce yourself to the audience. Let us know a little bit about yourself and things that you're doing, and then we'll move on to Michelle and Melisa, and then we'll get into the questions. So go ahead, Jenitha.
Hello, everyone. My name is Jenitha. I'm from Marshall Island. I've been working with Aecom since 2018. Is my great experience working with Aecom, and I'm here as a administrative assistant.
Thank you. And we will definitely get to know more about you as we go forward. And then we have Michelle Pedro with us. If you can do the same thing, just kind of introduce yourself to the viewers and the listeners, and then we'll get on to Melisa, and then we'll move on with the show.
Yahweh. Just want to say Yahweh to all my family and friends out there. My name is Michelle Pedro, and I work for Arkansas Coalition of Marshallese, Aecom, as the Policy Director and Communications Specialist.
Awesome. Welcome, Michelle. And then we have Melisa Leyland. Melisa is a native Marshall Islander, born and raised in the Marshall Islands. At age 16, she graduated at the top of her high school in the islands. A year later, she enlisted in the United States Armed Forces. While in the Army, she was offered the opportunity to serve as a logistics specialist within various units throughout the United States and abroad, including Asia and Europe. It was then that she acquainted with people from different cultures and became more appreciative of the diversity she was experiencing. So after 10 years in the service, she moved to Arkansas to attend the University of Arkansas in 2004, where she studied international relations. I believe she's a graduate now of that. I have an outdated bio, but I'm working my way through it. Let's see, she holds dual citizenship in the Marshallese community and the United States. She attained her citizenship in 2011. Congratulations with that. In 2011, along with other Marshallese leaders, Laelan founded the Arkansas Coalition of Marshallese, Aecom. And in the year 2015, Aecom received its nonprofit status, making it the first organized, founded, and directed by native Marshallese Islanders. As a executive director of Aecom, she has become a resource contact in both Marshallese and non-Marshallese communities. As the Marshallese community continues to grow in Arkansas, she's frequently visited by many. Welcome, Melisa.
Good to be here. Thank you, Carl.
You're welcome. So this is one of the shows that Naki's not with us today, but we had talked a lot about everything that's going on in Arkansas. And we had talked about when the numbers first came out that there was a lot of talk in the PI community about, we didn't know there were Pacific Islanders in Arkansas. Like at one point, the numbers coming out of Arkansas were not per capita outpacing California. It was outright, the numbers in Arkansas were higher, just total number, than California. So, you know, we kind of start this off with a question for the group, and I'll do it the same way we did it with the California groups in Utah. And it is that kind of thing of like, what drew you to Arkansas? And what's your favorite part about living in Arkansas? And let's start with Michelle.
Okay, so what drew me here to Arkansas was, the community. I heard that there was a lot of opportunity here. So my husband came out here first, and then me and my family, my kids, we followed, and we just love it here. And the community here is just really a generous community. What was the other question?
What's your favorite thing about living in Arkansas? Is it I don't know, the Razorbacks? Is it, is the community events? Like, what's the good thing for you about living in Arkansas?
I would have to say community. And I don't miss the traffic like out there in California. um, and the prices here are just, it's awesome. I don't have to worry about the high living cost. And just, being around relatives, every day is a day I learn that I'm related to somebody.
Yeah, I think the a lot of people are finding that are leaving California and Hawaii is we don't really understand how high the cost of living is until we move to Utah or we move to Arkansas or we move to, some other place besides a really high cost of living place and go, wow, it's there's a whole different world out there. So awesome.
I also lived out in Oregon,
Oh,
and
really?
yeah, what I miss about Oregon is, there's no taxes. So
That's right. No sales tax. A lot of people live in Vancouver that there's no state tax in Washington, and then they do their shopping across the bridge in
Mhm.
Oregon where there's no sales tax, maximizing that tax advantage. Um, let's see, Jenitha, how about yourself? What drew you to Arkansas, and then what's your favorite part about living there?
What drew me to Arkansas is, of course, the community. I got recruited from San Diego to come and work with Northwest Arkansas Community College over here. And the first time that I came and worked with the college over here, it was like only few Marshallese students were attending that. But being a mentor to those students that graduated from the high school, after I left the college, there were more than 50 Marshallese students attended.
Wow.
And what was the other question? I'm sorry.
The other question is what do you like about now that you're living in Arkansas? What's your favorite part about living there?
My favorite part is that I don't miss home. Is everyone here is like I'm excited. I feel like I'm at home. Is my community, is the people, is everything.
Yeah, I think the having the community with you really helps it stop being a place that you're at and makes it into home where you're not
Yeah.
just there as kind of I'll be here until I return to or I go somewhere else. And we're learning that from that. Naki and I were like, it must be amazing to be around your people
Yeah.
in a in a place that people wouldn't expect to find Pacific Islanders or a Marshallese community. Melissa, how about you? Same questions. What drew you out there, and then what's your favorite part about living there? Oh, you're on mute.
Sorry about that.
That's okay.
What drew me out here really initially was University of Arkansas. Then I came, attended University of Arkansas, and then saw really this community that is sort of like growing. So I did like that a lot because and as Michelle and Jenitha had mentioned, this is really a community where you feel like you belong. So instantly I felt like I belong to this community. So I fell in love with it. And but further on, you know, uh, later on, I became a court interpreter. So I did that job and realized that there were a lot of gaps in services, particularly to especially resources, right? Like lack of resources. So instantly, I just thought about bring in resources and organizing. And I think it became more than just a community to me. It's my home. It's really and the feel, Pacific Islanders, we feel always this need to protect our people. Maybe I'm a little crazy, but I always feel this need to provide. We're providers. We're raised to be providers. So I think that sense really kicked in. And I've been here since 2004. As far as what is my favorite part of Arkansas is really um, it's amazing. It's really amazing to see the support and this strong community that is there. And on top of that, we're just our organization. These two ladies that are colleagues of mine who are with me on the show. They're just like kicking butt. Excuse my language, but and it's amazing to see that. To see young Marshallese woman and be able to kick down all the doors and all barriers. It's amazing. So I think that's the favorite part of it is to be able to give back to our people and not just the Marshallese community, but also like Springdale in general and Arkansas, because again, this is a growing, and the population is going to continue to grow. So it's amazing to see that.
That's awesome. I think the work that you ladies have been doing, it's recognized by the Pacific Islander community. I mean, it's taken far too long to get this team onto the show, because of how well recognized what you're doing, and what you've been doing from before COVID-19 was around, but especially with COVID-19. And so, talk a little bit about Aecom, and the beginning of Aecom, and what the concept was when you were building the organization. And you said there's a need for this to exist. Was there an event, or was there something that you saw where there was a specific need for it, and then you said, "Hey, we got to make the organization," or were you kind of doing things already?
I think by nature, I am is many, and you mentioned this earlier. I am a veteran, and so I was trained to provide solutions to issues that we're faced with. But then on top of that, I became a court interpreter. And my exposure to that in the court system really was, I think it was like the gateway for me to start realizing, and the visibility of challenges and barriers became more and more apparent to me, that there need to be there need to be serious conversation around organizing. My first um, kind of uh, open eye openers was really the court system. I saw a lot of juveniles getting themselves in, and not only that, but also the service providers. I mean, the lack of understanding our culture is really deep. Even to this day, we just had an incident at the school system a few weeks ago where Marshallese, this teacher was talking to a non-Marshallese student, and the student was not looking straight eye to eye to the teacher. So the student was the teacher said something along the line of, "You acting like a Marshallese person," you know. So that tells you, even 20 years later, almost 30 years later, we still have people who are not aware of our culture. If you really know, staring or looking at somebody while they're talking is very insulting, right? It's like, I want to fight you. So those things like that, it's really the need to be, to me, you need to put yourself in there. Islanders need to put themselves in a center and make sure that everyone is aware of your culture. And I think just seeing everything that I've seen as an interpreter really pushed me to be more motivated to organize. And I'm a firm believer in we need to get ourselves going. We need to really initiate things that are made by us and for us. So, I think Aecom was really the first kind of this first system that we created to do that.
Yeah, I talked to a Samoan interpreter in San Francisco, and she was saying the same thing, that she could tell that there were, as she served as the interpreter, she could tell that there were Samoan people that didn't understand the system. They didn't understand like how they were getting taken advantage of. Like they were just going through the system, and they didn't understand what was going on. So I think that would be a huge exposure that would drive the want to help that, to have a better resource for people. Michelle, how about you? What drew you to Aecom?
Melisa.
What's that? Oh, that's a great point.
Well, I was hired on part-time to do census work with Jenitha, and then later on, my role to come on as the policy director, because we saw that a lot of there was a lot of issues affecting us, even if we didn't know about it. People needed to hear that census was important, voter registration is important, issues that affect us like Medicaid, health issues, health disparities, racial equity, health equity. A lot of the times our youth don't really realize that all of the policies that come down to us also affect them. And so, excuse me. And so recognizing Aecom was one of the things that I really appreciate, the opportunity that I've been given with Aecom and from the community. This community has done a lot, not just for my family, but for each other. And I'm not just talking about the Marshallese community, I'm also talking about the other Pacific Islander communities around here, like the Gilbertese communities and the Asian communities around here. I just really respect the community here in Northwest Arkansas. And so Aecom has done a lot. I mean, people don't really see it or realize it, but Aecom does a lot of work, and I'm just really grateful to be a part of it.
I think that really says a lot when you say, when I asked what drew you to Aecom, and it was a person, it was somebody's passion, it was somebody, it wasn't necessarily the organization, it was Melisa. And I think that's important. Like we've said already, is that we need to see our people doing things. Like that's what the younger generation needs to see, is that our people can do these things and see people actually doing it. So we're a huge believer of role models and modeling. When you see things being done, then hey, I'm inspired by a person or actions that they're doing. So I think that's fantastic. Jenitha, how about you? What brought you to the Aecom team?
I really don't know. First, I was hired to get people enrolled into Obamacare. And the more I was with Aecom, I was like impressed, because there's like only little times for me to be with Aecom, but I know a lot of what's going around within my community compared to when I wasn't working and just sitting at home. And I was so impressed by the work that this office has been doing. I came in and I'm like, wow, these there's only like there was no men, but these women, they're so superpower. Yep.
Yeah, that's Naki and I talk about that all the time. About somewhere there is a young lady that's watching one of you three or all of you three, that are going to be inspired by that. And many times they don't, they may go on and move somewhere else and end up doing things, but they're inspired by people that they see, and they're at an impressionable age and those kind of things. Seeing you ladies do what you do, you may never know how much you affect not just the next generation. It could be like I see young people inspire older people all the time. So it doesn't always have to be
Mhm.
young people that are inspired by older people. I've seen young people pursue their passion and seen older people look at that and go, wow, like that's inspiring. I can do that. Doesn't matter what age I am. So it's really hard to understand how big of a wake that you ladies leave in the community. So that's fantastic to hear. Um, so COVID-19 has really been, we've gone through stages. We had COVID-19 and we didn't have our data. Like we didn't have the data disaggregated, or they hadn't published data yet. But I think there was suspicion that it was hurting us more than other communities. And then the data came out, and we had the proof. We said, okay, now we know that we're being affected on a larger scale. And then everybody, it was amazing to us how people mobilized that didn't know anything about, there weren't epidemiologists out there that were in every city saying, oh, I know all about, infectious disease. I'm going to jump in. It was just roll your sleeves up and help your community, however, kind of learned as we went. So then we went through we got to get tested phase, um, you know, all these different phases. Right now, it's all, everybody's talking about the vaccine. What's important to each of you in the role that you play at Aecom and in your community right now? Like, what is the important thing that you're trying to communicate to the Marshallese community in your role at Aecom? And then let's just, Jenitha is still on my screen, so I'll just go with her first.
Okay. What is important for me to be part of Aecom is giving out what we have to our own people. Working for Aecom make me feel like greater than myself, and it's give me like an opportunity to connect with my own people. So whenever I help my own people, I feel so great of what we're doing here. And we always help them, like whatever need they have, they come into the office, we have to provide them, even though we don't have the service they were seeking for. We have to be like ongoing every day. And it's make me feel safe and secure, like, because when I'm working with Aecom, I know what's going around within my own community. It really make me feel safe that I can be the first one to know what's going around, what's happening.
Yeah, it's so true that information is power, and having information makes you feel empowered, where you're not guessing at what's going on. And I think that the role that Aecom plays with the Marshallese community is a piece of that, like keeping your community informed, so they're not guessing or looking at somebody on TV and wondering, are they, is that slanted? Is that biased? If we hear the news from our community-based organization, that will reach some people that CNN or Fox or whatever wouldn't reach as well. So I think that's a really good point, Jenitha. Michelle, how about yourself as the policy director at this point where we're really pushing the vaccine? There's vaccine hesitancy, so to speak. There's anti-vaxxers. In your role, what is most important to you at this point, at this stage with COVID?
What's the most important is life, preservation of life. My mom, just for example, I love her to death, but she's scared to take the vaccine. And so one of the arguments that I let her know is, they've done research on it. Only one person, had complications and died from it, versus the 500,000 and more, or 500,000 people or more that's passed away from it. And so she says, I'm old and I'm weak, and the more information you have, Mom, the better. Just get the vaccine. Even that's the more reason for you to get the vaccine, is because you think you're old and you're weak, but you're not. You're just you're just living. You're beginning life right now. And so I think for a lot of our elders, because many of them have passed away. Sorry. Because many of them have passed away before they could get insurance or before, you know, they could get the help that they needed. I'm just really grateful to have helped them obtain somewhat of an insurance and just being part of that work. And so life and preservation of life, and then quality of care.
So important, especially for the elders. And I think that, you know, I've talked to some Pacific Islanders where they're like my auntie or my grandmother, they want to hear it from, you know, their spiritual leaders. So they want to hear it from, you know, a doctor. They want to hear it from somebody besides me. And so they've actually ran into like kind of a cultural issue, like with the elder wants to hear it from somebody besides their grandchildren or their children. But I think the important thing is what you're saying is finding a way to reach them, however it is. Like if they need to hear it from, you know, their pastor, then we get pastors to say it. If they need to hear it from a doctor that's a Pacific Islander. But just being in tune with the community helps with that, because however people need to hear the message, we can, you know, find a way for that. So, I mean, preservation of life, that's a great way to put it. Melisa, how about you? What's in your role as the ED at Aecom? What's the priority with you?
I wish I could just pinpoint one thing and say that's really my priority. But I love how Michelle brought up life, but also the other things that comes with it, right? Like I cannot just focus on health. I have to focus on other needs too, you know, housing, and all those social determinants that make someone have a good quality of life. And of course, you know, with the situation that we're faced with right now with COVID-19, it's even more important for us to acknowledge the other social determinants that are there that make someone have a good life. You know, for example, we do have uh, the rent assistance program where we help families with their rent, with paying their rent. Guess what? If we don't help these families with their rent, that's going to leave them where they are homeless. And of course, that's part of housing, right? So, you know, it's important for us to look at various, to me, variables that make one have a good quality of life. Food need, there's a huge need for it as well. We do have a food pantry that focuses on that. So it's really, you know, me, the way I look at it is, what can I do to ensure that someone has a life, not just life, but someone has a good quality of life. Someone has the really, uh, I guess I would say life equity, right? Where they can, you know, it's just various things. They can have they'll be able to have a good job where they can be able to pay for their housing needs, be able to pay for food, be able to pay for whatever that make that family have a good quality of life. So I think it's kind of hard for me to just say one thing. You know, for me, you know, I kind of look at things macro, I guess, where you got to look at the overall needs of what makes a good quality of life of an individual. So it covers everything, you know, policy. We've, you know, for over 25 years, COFA citizens were kicked out of this Medicaid program. So that's why it's very important. The role of Michelle as a policy director is very important for us to address sort of those things. You know, what there are things that unfortunately the system has built to prevent, you know, folks like us, the Pacific Islanders, where they don't have access to certain things. They have very limited access to healthcare. That COFI and the Medicaid was a perfect example. So those are things to me that are, you know, you have to, as an executive director, I have to look at the macro perspective of what our role is within the community. And that's, to me, everything is so inclusive. It's like everything that comes with making a life good and having a good quality of life.
And I think that's a really good point, that the people that are more concerned about getting their next meal or staying in housing are going to have a tougher time prioritizing a invisible infectious disease than it will for people who have consistent housing. They're not worried about food. They're not worried about their next meal. It's easier to prioritize that high, where opposed to where you're just worrying about where dinner is going to come from, or how I'm going to feed my kid, or am I going to have a roof over my head tomorrow? Those kind of things are really hard to get people to prioritize, because it's like I said, it's an invisible infectious disease. Was that a difficult thing early on with COVID-19 to educate the Marshallese community to? Because it was hard. I know it was hard, specifically in the Samoan community. It was hard with the cultural things of gathering and those kind of things. It was this invisible thing. So let's start with Jenitha. And did you see that as a challenge? Because more Pacific Islanders are more likely to be worried about their next meal and their housing. Was education a hard thing that you saw early on?
Yes, I would say yes. It was so difficult, especially for us Marshallese, because we like to gather around. Like that was our biggest. Like we love to gather together. We love to gather and to every event. And it was so difficult to let our own people know that they have to stop. We have to stop, even though it's cultural, but we need to stop. Especially and also to our church member. Every time we have to go to church, it's on it's, it is in our system that we need to get up every Sunday and go to church. And we're so used to that. Even the little ones, they're so used to that. Every Sunday morning they get up and say, Mommy, I have to go to church. I need to go to church. But we have to tell them every day, there's no church. We're not going back. We have to wait until it's safe. It was so difficult for us.
Thank you, Janitha. Michelle, what was that from your standpoint? Was it just continued messaging and awareness, or like did you see the same challenges early on, and do you continue to see those as we're past, like we continue to talk about social distancing and wearing a mask and being safe and those kind of things, but now it's the vaccination. Do we face those things over and over in each of the stages, or do you think that we've kind of not knocked down the walls, but kind of laid the groundwork for success with vaccination from your standpoint, Michelle?
Yes, it is difficult, especially now with the vaccine being available. A lot of the times people are just like, oh, you got vaccinated. Now we don't have to worry about it anymore. We don't have to worry about wearing masks. Especially during the times when people were passing away. We wanted to show our support to the family, and so gathering in those situations, or being at the hospital, that's one cultural aspect of us showing support, is showing up. And so encouraging our families, like, hey, that's the hospital rule. You can't be in there with the patient. Explaining to our elders, like, if you go in there, that's, make sure you have an interpreter, because I can't go in with you. I'm so sorry that you have to go in there by yourself. And then letting them go there, and then later on finding out that they passed away and that was your last words. So guilt is also a factor. And I think right now a lot of people are just like, okay, you got vaccine. And so trying to educate our folks, saying that just because we got the vaccine, we still don't know who has been vaccinated and who hasn't. And so we just still got to follow the guidelines and keep everybody safe.
Yeah, that's definitely a factor. Is that what we've talked about, like gathering? We want to gather. We want to go to church. There's funerals are a much bigger um, event in our lives than other cultures, and it's hard. And I think that's one of the things that I saw in the Samoan community was like, wait, you go to the hospital and the family can't show up because normally you got 30, 40, 50 people taking up different floors if they have one person in the hospital, and to think that your elder could go to the hospital and you can't go be there for them because
Mhm.
normally if you're in the hospital there's somebody there. In the middle of the night, you wake up and you want water, there's somebody sleeping there and they go get the nurse or they go, get whatever you want. And to not have that, I think was a real eye opener or a shocker that those were rules that we couldn't bypass. We couldn't just, like I remember being at, if you go to the hospital and we bring our own food, they got a cafeteria down there and you got Pacific Islanders walking in literally with like plates and plates and plates of food. But it's just not that way with COVID-19. Um, so good point with that, Melissa. Um, those have been the obstacles or the challenges that really Pacific Islanders have faced as a group. There's different Micronesian, Melanesian, Polynesian, but it's still a lot of the cultures are very similar. How did you go about from organizational standpoint with Aecom with tackling things like gathering or needing to hear things from the pastor, or not going to the hospital, those kind of things, those cultural things? How did Aecom go about facing those and still educating your community?
I think your specific question to Jenitha, was it hard for us for the people to respond to the bigger perspective of education? When they have these little needs, like these small things that they have to do, it was really the opposite of from the organization standpoint. We knew we had to react. That's really one good thing about Aecom is very we react instantly. We identify, and that's we started even before, like right before COVID hit Arkansas, specifically in the Marshallese community. We already in the thinking mode. We got that the community need assessment. We launched it, and that came back with over 450 survey takers, respondents. So we, even right off the back, we already had identified those needs that we needed to go dive right into, and we did that. We instantly look for funders, and we were very very successful in that. And that's because we had that thinking hat on. You need to react now because things, we don't know how dangerous this thing is, this virus is, but we remember this has been a community that hadn't had access to Medicaid for 25 years. So what we have suffered all along, with chronic diseases, our especially the elder generation, they didn't have access to healthcare. So, and based on what we know about this virus, we knew that it was going to hit us. We just didn't know how bad it was going to be. So we already had a plan. Thanks to Nia, Dr. Nia, she helped us. She helped us, with this community need assessment, as well as a few of our consultants, Bonnie and those folks. So it was kind of, for me, looking from an organizational standpoint, it was easy for us to line everything up. So instantly we had that while people were looking for funding, we already had funded to be able to serve the community, pay for the rent, pay for the bills. And then we instantly move on to the next item of need, which was identified by the community, and that was food, right? So we started a food pantry. It's Marshallese and Food Pantry. Um, that was very, very successful. That's when we started realizing that food insecurity was huge in our community. We didn't know that until we actually started that. Then PPE, that was, I think that was the second, maybe the second or the third need was the PPE. And that was good because myself, I had personally received emails from the public saying things like, you need to educate your people. You need to let them know that they need to wear PPE. Well, guess what? The community was responding with, we need PPE. So that tells us that they wanted to protect themselves. So it really was the opposite of what people were thinking. In terms of, we instantly also, we hired a nurse. We hired a nurse, Nurse Philmar, who came in and who really took on the role of providing weekly education of COVID-19 to the community. And that was very, very successful. I know Michelle was part of that team as well. But people responded to that. I mean, people really tuned in and they listened in. Yes, they had other needs that were short term, that they were immediate, but also they were able to listen in to Nurse Philmar, because we made that accessible to them. The thing is, we needed to go to them. We need to make sure that every resources is accessible to the community. And that's what we did.
It seems like, well, I have my own thought, but it's I'll reserve my thought for after, because I want to ask the team this. And let's start with Michelle. Why do you think Aecom has been as successful with COVID-19 as it has been? Because I've seen a lot of areas not have the success in serving the community as quickly as Aecom did. What's your thoughts on why Aecom has been as successful as it has with COVID-19?
To be honest, I'm not really sure, but I think it's because of our stewardship. And, a lot of the work that we do is because of heart. And we try to reach out to people because we care about them. And we just want them to know that no matter what, even though, we got the odds stacked up against us, that we're still here and we're going to still fight for them.
Yeah, hard work is hard work. Sometimes people don't get that. They think, well, if you love what you're doing, then, I saw a shirt that said, if you find a job doing what you love, you don't work a day in your life. And I was looking at it going, well, I do what I love a lot, and I hit the bed exhausted many times. Like, I'm working hard. Hard work is truly hard. And I think that's a great point. Stewardship is probably one of the reasons Aecom has been so successful in serving the Marshallese community in Arkansas. Jenitha, how about you? Why do you think that Aecom has been as successful as it has been?
I think it's because the community would know where to go. They always depend on Aecom, and but it's especially for Melisa, because she's a hardworking. She always, like, we dream about something and she'll make it happen. Yep.
That's that's a belief in what you're doing. Often comes from a leader, and it's clear. It was clear long before we got Arkansas on our schedule that Melisa is doing a great job leading that. So, Melisa, your thoughts on why Aecom has been as successful as it has been?
Yeah, I think it's, we always listen to the community, and, also we have people who are very dedicated to this work, not just myself, but also the board. The board is really engaging, and they want to know what the community thinks. So I think it's, is the fact that you have the great team, you have to get the right team on the bus. I think that's why we have a very, very successful work here in Arkansas. and it's dedication. I also always talk to my staff, it will not work if you do not believe in it. So you have to believe in what you're doing. If you don't believe in yourself, it's useless. You have to believe it. You have to know that what you're doing is good for the community.
Yeah, that was my thought on why Aecom has been successful as it has been, is because you were successful before COVID-19 came. You are already tied into your community. Your community already believed in Aecom. So when Aecom was there and said, hey, these things are important, to get 450 surveys initially, there were, cities with way more population in California than other areas that had a hard time with it, because I don't know if the infrastructure was there, that was the resource, that was the organization to go to. So I think it's just doing the work. Aecom was already doing the work. Um, do you think there are things that, Melisa, do you think there are things that we've learned through COVID that we can continue? The example I would give is there are companies across the country right now that are closing all over parts of their corporate office because they found out that people can work from home. They found a better way because of COVID, right? So COVID has given them, perspective on some better ways to do things that they're going to keep after COVID leaves. Are there things you think that Aecom or the Pacific Islander community has learned from COVID that we can take forward after COVID, after we're done with COVID?
Yes, I definitely think there are things that we have learned, new things that has arise through COVID, and hope that we continue to do. And Zoom is actually one of them. We used to be very old fashioned, very just do things the normal way. But Zoom, things like Zoom really forced us to look into other things. That was a very it was a learning curve for us, as well as policy. I think we added on this policy deal, policy program uh, when we started seeing COVID, and also the relationship that we have with our legislators. That was one thing that we also hope to continue, is to have that great relationship and be able to have a communication with our legislators. We used to think that they are unreachable, like they're so far way out that we couldn't touch them. But I think COVID-19 brought that to us, that you can actually do these things. And also we became more I don't know, more smarter at looking at things. And what I mean by that, now we know how to communicate our status or our data through things like press release. We're more professional now, so I think we have learned so much. Especially after the community need assessment and the COFA Medicaid restoration. We were able to put things together to be able to kind of communicate out what's happening with the COFA Medicaid, and so many other things. Housing. I mean, that's one thing that I hope that we continue to do, is housing need, as well as food. Food insecurity. But the food insecurity thing really is leading us to also back to policy. Marshallese do not have access to the SNAP program. So that's we're currently looking at that. How do you work around that? As far as policy? So yeah, there are a lot of other things that we have. We also learned that you know people have like these needs that they have to address immediately. You can't expect to address things like purchasing a home when people really can have a hard time paying their bills. So that was one thing that I learned as well, because at that time we have a program that we're helping families to purchase their first home. We were really telling these families they need to save up money in order to get them to where they can purchase a home. Well, we learned that immediately after the COVID-19, that you just can't do that. Some families just don't have don't make enough money. And with COVID, it was even worse.
Yeah, that great point. We should have all bought stock in Zoom last year. Everybody Zooms now. And it's a good point. It's something that we can, we weren't doing before. Telemeetings definitely are going to be something we carry forward. And I couldn't have asked for a better segue. You said policy several times. So I'm going to turn it over to Michelle. Are there things that you learned in your role with Aecom that you're going to continue or that you can take forward after COVID, after we get COVID behind us?
Well, she said professional, right? So I'm just gonna keep my personality. I learned that a lot of people, they really appreciate, not being so serious, because we're just serious all the time now. And so Zoom fatigue, I appreciate in person, meeting people in person or having coffee with people in person, because through Zoom, it's not really personable, but meeting people and having coffee or just conversation, just trying to stay connected with people. I will really value staying connected with our elders. A conversation I had today, I learned about my own atoll. A lot of it had to do with our elders being, really connected with each other and sharing their demon stories. So I appreciate that. And then, I mean, I like Zoom because then, I don't have to really dress up. But I also appreciate that social aspect of just being able to share in person. And so I don't know, I think it really depends on who I'm with and what I'm doing. And if it's for policy, I really appreciate how I can connect with our legislator. However and whenever, if it's through Zoom, then so be it. But I've learned that a few of our legislators like in person more than the Zoom. Zoom is kind of confusing for our elders, but I mean, I don't know. I really don't know what I will take and what I will leave. So
I think I'm with you. I think I will take the appreciation for the face to face. I'll take that far greater than I did before. I just took it for granted that, meetings are in person and you can watch, the person's reactions and you can see, you can do things in person better than you can in Zoom and just being face to face. I didn't appreciate that nearly as much as I will coming out of COVID is just having an actual meeting. So Zoom has its place, but I agree with you. The appreciation for the actual face-to-face meeting is different. Is a great point about the legislature. You've talked about that twice now. We've talked about the relationships that we had, that we've built. Either we built before, or we accentuated through COVID, and the need to do that. But continuing to build those and continuing to have that platform and that relationship is awesome. Jenitha, how about yourself? Anything that you've learned through our COVID journey that you're going to take forward with you?
Well, as for me, I would say I really love what we're doing, like doing Zoom and everything, because I don't have to leave my office and like rush to where the meeting is at. And also, I really wish that we will continue get funding for rent and also for our food pantries to help our families in need.
Awesome. We have a question coming in from our Facebook Live, I think. And the question is from Moana Trammell. Besides food and housing resources, how are you, the coalition, helping educate the community for opportunities to create wealth for themselves? My personal thought would be that you're trying to take things like housing and food and understanding of resources and those things, trying to remove those as obstacles so that they're able to create wealth and move forward in their career. But I'll throw that out to anybody that wants to answer it from Aecom. How do we educate the community for opportunities to create wealth for themselves?
Yeah. Well, I think that's what Aecom is. And I often tell my staff for the board, things like, let's work really hard, because I don't want to have Aecom in 20 years. There's a reason why I say that. Hopefully by then we've really established a community, a resilient community where folks will be able to, you know, be independent and be sustained and be able to have the same resources just like anyone else. So what we're doing now is we have several programs that we provide education on, to prepare folks for that day, right? For 20 years from now. That's my hope. My hope is to not have Aecom anymore, because we've already helped so many families that they are strong and resilient and be able to function on their own. So we have various programs. One of them is the biggest program that we have right now, and we're running, is the diabetes prevention program that is led by Nia, Dr. Nia. And that in that program, we educate families. We educate folks who are at risk to become diabetic. So we are taking those small steps right now. So that way we reach that 20-year mark. We also have programs like the financial literacy program that we are helping families building credit or fix their credit, or doing those small budgeting classes, doing little stuff to ensure that they are financially thriving on that day. So we also have other stuff that we're doing. We always help with writing resume or job fairs or things like that. So yeah, there are a lot of initiatives that Aecom is in programs that Aecom is providing at this point, to help those families get to where they need to be at.
I think that's why you were so successful with COVID-19, is because you're doing these programs. You're doing these programs that are affecting people's lives. So when something important and as severe as COVID-19 comes along, they see you as a source of information, a trusted source of information, and a member of the community overall. So I think that speaks to what Aecom has built. I mean, that's no mistake that why you ladies are so successful. So an hour has flown by. I'm going to ask if anybody's got shout outs, and let you all get them out there. And then if there's any information where people need to get a hold of Aecom, you can speak to your Marshallese community. We'll start with Jenitha. Any shout outs or information you want to get out there? Jenitha? Oh, there you go.
Yeah. What do you mean by any shout out to the community, or
is there any like people that you would like to say, hey, thank you to, or get their names out, or is there contact information that you want to get out to the Marshallese community for yourself?
Yes, I would love to shout out to my own community, my Marshallese community, and let them know that we are still here and we will still be here waiting for them, serving them. And they know where to reach us and where to, if they even complaints, we're gladly to take complaints.
Thank you. Thank you
And
so much.
they can always reach us at our office, and they know where it is.
Okay. Thank you, Jenitha. Michelle, any shout outs for you?
Same shout out to our Marshallese community, not just here in Northwest Arkansas, but all over wherever they're at. Shout out to my husband and my kids. Every time they see me on TV or social media, they're just like, oh my gosh, my mom is famous. Well, shout out to my kids. And to all the elders out there and youth, we are in our sign up phase for our Laelan Youth Leadership Program. So sign up. And I just want to say thank you, Koviki Talk and Dr. Nia and Tavai, Epic. Just shout out to and thank you for, to our community, just for being supportive of each other. And thank you, Melisa, for everything you've done. not just for me, but for my family.
Thank you, Michelle. That's a great point. For every community activist, community spokesperson, there is a family at home that misses time with those people because they're so involved and they work so hard. So the families that are supporting the workers that are out there are definitely a big piece of the picture. Melisa, how about yourself?
I just shout out to everyone who is listening, and of course to you, Carl, Nia, and Christine. Thank you so much for this opportunity. But if folks out there who are listening in the community, you can check us out at www.arkansasmarshallese.org, or you can call our office 479-365-6625.
Awesome. Thank you, Arkansas, Melisa, Jenitha, Michelle. If there's a model for how to serve your community and how to be in touch and in tune with them and be successful when something like this comes up, it's to be found in Northern Arkansas. So thank you, ladies, for your time. And thank you, everybody, for tuning in to Koviki Talk, and we will see you next week.